Hi, I'm Glenn Pearson, author of the book Thriving in the Healthcare Market, Strategies from an Industry Insider for Selling Your Product. And I'd like to welcome you to today's flash interview that ACO Exhibit Hall is doing. And please meet Bill Paschal, who's the VP of Business Development at Vivify Health. And what Vivify Health does is they provide remote patient monitoring, focusing on connected care management and patient engagement. So Bill, welcome to the podcast, and just have a couple of questions for you. Tell us what you guys do that would be of interest to ACOs.
So we supply different modalities of engaging patients and reducing ED visits and 30-day readmissions, which is really what we find with ACOs is kind of the sweet spot and the focus. We have kits, mobile and web apps, all designed really to engage the patient, educate the patient, reinforce that good behavior, virtual coaching, communication, that all lead that patient towards self-management. We recently had one of the top 5 ACOs ranked nationally in the stage 2 or full risk category, deciding recently to really expand their use of Vivify's remote patient monitoring solutions in order to really help reduce the overall cost of care to those patients because of the benefits they'd seen with, as I said before, with the reduction in ED visits and rehospitalizations. On our website, there's a place you can go and look at many different customers' data points on those value-based care models, places like University of Pittsburgh Medical Center, Trinity Health, and others to see we're typically reducing those unscheduled acute care by 65% or more, and with very high patient engagement and patient satisfaction.
Great. Tell me something unique about your services that sets you apart from other people that offer that type of care.
So Vivify Health was founded in 2009 by a team that had 20 years experience in healthcare and with user interfaces for patients. So really what we hear back from our customers is differentiation is simplicity in the use or user interface for the patient and for the caregiver, and flexibility. So we, of course, for remote patient monitoring, we started really concentrating on the complex chronic, that 5% of the population that consumes over 50% of healthcare resources. But our customers, because our back-end system is so flexible and content-driven, are now managing patients with for over 80 different clinical conditions. So that's really what I would say, that customization for content, simplicity, and flexibility.
Okay, well, it sounds like you have a robust suite of services, and the proof's in the pudding, I guess, as they say, and with an impressive client roster like that. So thank you for spending a couple minutes with us today. And if listeners are interested in finding out more about your company, they can go to the ACO Exhibit Hall and visit the Vivify Health booth. And I'd like to just, again, mention the book that I wrote a couple of years ago that helps anybody trying to sell into the healthcare world understand some of the pitfalls that can threaten companies because they may not understand all the challenges and the dynamics of the healthcare industry. So you can check it out on Amazon. And thanks again for your time, everybody, and tune in next time.